This is the childbirth skill. First, I want to ensure that I have my BSI on, my safety glasses, and my gloves. Next, I need to determine if childbirth is imminent. I'm going to ask the patient how far apart her contractions are, how long they last, and the feeling she doesn't need to bear down. Next, I need to observe for crowning. I'm going to expose the area, and I see obvious crowning. I'm going to open my childbirth kit. I'm going to take out my handy wipes. I'm going to wipe the perineum anteriorly to posteriorly, once, twice, and the third time. Next, I'm going to take out my sterile gloves, and I'm going to put them on in a sterile manner. At this time, I'm going to drape a sterile field. I'm going to place the first one under the buttocks. I'll ask the patient to lift up her buttocks. And I'm going to place another one on this leg here, and another one over this leg. At this point, the baby is going to start delivering. So I'm going to place one hand on the crown of the child's head, another under the perineum here, and I'm going to control expulsion. As the child's head delivers, I'm going to look at the neck, look for signs of a nuchal cord. If there is a cord around the neck, I'm going to take my two fingers, I'm going to free it over the child's head. If I can't, I'm going to clamp in two locations and cut between the clamps. Once that's taken care of, the child's going to rotate, and then I'm going to assist the upper and then lower shoulders out. I'm going to get a firm but gentle grip on the child and keep the child at the level of the birth canal. At this point, I'm going to observe for any kind of secretions that might be interfering with the child's airway. If there are excessive secretions, I would suction. I'm going to expel the air from the bulb syringe. I'm going to suction the mouth and then the nose. Once that's done, I'm going to take a towel and I'm going to stimulate, warm, and dry the child. I'm going to get a fresh, dry towel, and I'm going to wrap the child up to keep them warm. And I'm going to place head covering on the child to keep or prevent heat loss. At this point, I would do a 1-minute APGAR. It's appearance, pulse, grimace, activity, and respirations. I would clamp the cord 6 to 8 inches from the baby, and then 1 to 3 inches past that, and then cut the cord between the clamps. Once that's done, I would do a 5-minute APGAR, and I would place baby to breast. That would encourage bonding as well as postpartum hemorrhage control. The placenta is going to deliver. I'm going to look and see if it's intact or not. I'm going to place it into a plastic bag for transport to the hospital. I'm also going to place a ID on the baby as well as the mother. I'm going to observe for hemorrhaging. I'm going to place a towelette on over the vaginal opening. I'm going to assess and massage the fundus every 5 minutes and transport both mother and baby to the hospital.